So in today's tutorials, we are going to be looking at the anatomy of the heart. So we are going to be looking at the anatomy of the heart into detail. All that is to say about the heart, those are the things, or that is what we are going to be looking at in today's tutorial. So please brace yourself as we go. Let's look at the content that you'll be talking about today. That is our next slide. All right, so in today's tutorials, we are going to be looking at the position of the heart. We are going to be looking at some organs that are associated with the heart. We are going to be looking at some external structures of the heart. We are going to, so the external structures of the heart, we'll be looking at the pericardium, the myocardium, the endocardium, and then we are going to be looking at what? Some internal structures of the heart. We look at the flow of blood through the entire heart. We look at the systemic circulation, and we also look at what? The pulmonary circulation. Then when time permits, we look at the conduction system of the heart, we look at the cardiac cycle, and we look at how to read the electrocardiogram. But for now, let's start off with the position of the heart. But before we do that, in today's tutorials, I would like us to revise some anatomical positions, or yes, anatomical positions and planes. So I would like us to revise some anatomical positions and planes. So because we will be making use of these so much in our tutorial today. So just as you can see, anytime that you are looking at the upward side of a person or of an organ, we call that the superior aspect of the organ of that or of that individual. Then when we look at the bottom aspect, then we call that what? The inferior aspect. Are we following? Likewise, when we are looking at the front side of something, the front side, be it an organ or a person, we call it anatomically, we say that that is the anterior aspect of that organ or that person. Then when we're looking at the back, we say that what? That is the posterior aspect of what? Of the person. So I repeat, the upward side, we're looking at the upward side of something, we call it the superior, which is this. So you can see the arrow pointing to the upside. Then the downward side is the inferior, which is what we can see here. So the arrow is pointing downwards. Then the front side is what we call the anterior aspect. So the anterior aspect is the front side. The anterior aspect is the front side, and then the back side is the posterior aspect. So please let's take this into mind. Let's keep it into mind because we will be using it so much. So we are starting off with the position of the heart. So we are saying that the heart is roughly a cone-shaped hollow muscular organ located in the thoracic cavity. So the heart is roughly a cone-shaped hollow muscular organ. Muscular means it is made up of muscles, located in the thoracic cavity. Now it lies obliquely with about 2/3 of its weight at the left side of the body's midline. Obliquely means that it is lying from this level to this level. That is like something like from here to here, just as you can see. So you realize that it is not something that is lying straight this way, but rather it is lying in an oblique manner or in diagonally. You understand? So we say obliquely or diagonally. Yes. So it lies obliquely with about 2/3 of its weight at the left side. So just as you can see, most side of the weight is at the left side. You understand? Or the part that carries more weight is at the left side. So it is slightly shifted to the left, as you can see. Is that okay? Now, mind you, we just studied about the positions. So the inferior aspect of the heart is pointed and called the apex. The inferior aspect, and I said that what? Inferior means what? Downwards. And then its opposite is superior, which is the upwards. So the inferior aspect of the heart is pointed and called the apex. So when we look at the heart here, this is going to be the inferior aspect. This is going to be the inferior aspect. You understand? So that is our inferior aspect. And we are saying that the inferior aspect is what is pointed and called the apex. So these very level we have here, or this very side, is the apex of the heart, and then that apex is formed by the tip of the left ventricle. It is formed by the tip of the left ventricle. Don't worry, we'll get to it now. And then it rests on the diaphragm at the level of the feet intercostal space. It rests on the diaphragm at the level of the feet intercostal space. Don't worry, we will get there and you will understand. Now, it is directed anteriorly. Anterior means front, you understand? So it is directed frontally, as in like to the front. All right, so it is directed to the front. Inferiorly, that is to the down. So it is directed front, down, and to the left. You understand? So just as you can see, it is facing us, is directed to the front, slightly to the down, and then to the left. So it is slightly shifted to the left side, just as you can see. Are we following? All right, now we are also saying that, hello, there is someone in the meeting who hasn't muted him or herself. All right, done that already. Okay, all right, sorry guys, let's continue. Now the posterior surface, so we said anterior is front and posterior is back, or should we go back for you guys to see? Anterior is front and the posterior is back. So the posterior surface of the heart, which is best known as its base, which is the back side of the heart, which is its base, is formed by the atria, which is the upper chambers of the heart, mostly the left atrium, and then it extends to the level of the second rib. So let's go to the next slide and then we'll best understand what we just read from here. Okay, so still talking about the position of the heart. So here we are still saying that the heart rests on the diaphragm near the midline of the thoracic cavity. It rests on the diaphragm near the midline of the thoracic cavity. So just look at this. Sorry guys, hold on, let me change our transition so that you can be able to see it very well. I realize that the transition is moving a bit quick, so many people are unable to see it very well. Okay, I believe we can all see now. So the heart rests on the diaphragm near the midline of the thoracic cavity. The heart rests on the diaphragm near the midline of the thoracic cavity. Let's move to the next slide and let's see how this is actually happening. All right, so we are saying that the heart, it's resting on the diaphragm. So this is the diaphragm, just as you can all see. That's the diaphragm. The diaphragm is a layer of muscular tissues that help us to breathe. All right, so the heart rests on the diaphragm near the midline of the thoracic cavity. The thoracic cavity is simply what? The chest cavity, the space underneath our ribs where some organs are, which is where the heart, the lungs, and then the diaphragm are. That is the thoracic cavity. So we are saying that the heart rests on the diaphragm. So you can see the heart is perfectly resting on the diaphragm. It is sitting on the diaphragm and it is lying in the thoracic cavity. Do you understand? So when we come here, when you come to the image on your left, you realize that it is lying straight in the thoracic cavity. Is that okay? Let's now go back and see point 2. Now point 2 says that anterior posteriorly, which means that from front to back, don't forget we said anterior is front, so front to back, it extends from the sternum to the vertebral column. Anterior posteriorly, it extends from the sternum to what? The vertebra. Now the sternum is the breastbone. So when you touch in between your chest, should I say your chest? No, let me see your breast, because guys also have breast, you know. So when you touch in between your breast, you can see a hardened, bone, hardened flattened bone. That is your breastbone, or what? Your sternum. So anterior posteriorly, your heart extends from what? From that breastbone to your vertebral column. Your vertebral column, which is behind you at your back. So that is how your heart extends, from front to back, or front and then backwards. You understand? So you see, this is the front right here that we can see, and then it continues like that to the back, that is to the vertebral column, that you can see below here. Do you understand? So the heart continues in that manner. Okay, let's look at point 3. Point 3 says that superior inferiorly. Now mind you, I said superior means what? Above, and then inferior means what? Below. So superior inferiorly, it extends from the first rib to the diaphragm. All right, superior inferiorly, the heart extends from the very first rib at the top to the diaphragm. We spoke about the diaphragm already, don't forget. All right, so it extends. So the topmost part of the heart, which is likely the base, is what is located on the first rib. All right, and then its lowest part is resting on the diaphragm. Let's go back to the image and see that too for ourselves. Okay, so you can see that the very first rib here. All right, so we are saying that superior inferiorly, the heart extends from what? The first rib here. So you can see the aorta right here on the first rib. Do you understand? You can see the aorta right here on the first rib. That's the topmost part of it. That is where the heart starts from. That's the position of the heart superior inferiorly. So the superiorly, it is on the first rib, and the inferiorly, which is below, it is resting on the diaphragm, which you can see on the image here. Do you understand? So at the topmost part, that is the first rib, we can see it here, and then the downmost part, it is resting on the diaphragm right here. Let's go back and see the next one. Okay, and we are saying that medially it is located between the lungs and shifted slightly to the left. So it is located what? Between the lungs, and it is shifted slightly to the left. So our heart is actually on the left side. I mean, slightly shifted to the left side from the midline. All right. So in short, the heart to be located in a region called the mediastinum. All right, we are saying that what? The heart is located in a region called the mediastinum. So when they ask you what is the position of the heart, you can say the heart is located in a region called the mediastinum. However, anterior posteriorly, it extends from the sternum to the vertebral column. Superior inferiorly, it extends from the first rib to the diaphragm, and medially, it is what? In between the lungs, but slightly shifted to the left. Then you get a 10/10. You understand? Yes. All right, so let's continue from there. Okay, so the next thing that we are going to be looking at here is some organs that are connected, or some organs that are in connection to the heart. Okay, so we have organs associated with the heart. So the main organs that are actually associated with the heart is the blood vessels and the lungs. Those are the main organs that are associated with the heart, sorry. The blood vessels, so our blood vessels and the lungs. Those are the organs that are mainly connected with the heart. All right. Okay, so we are now moving on to the external structures of the heart. So the heart wall is made up of 3 layers of tissues. The heart wall is made up of what? 3 layers of tissues, and then these layers are the outer layer, which is the pericardium, the middle layer, which is the myocardium, and then the innermost layer, which is the endocardium. Now let's look at the notes under the surface cardium. When we say a surface, it means that there is some word before it comes. You understand? So for instance, you can see that here we have peri before the cardium, so that makes it a surface. We have myo before the cardium, so that makes cardium a surface. We have endo before the cardium, that makes what? Cardium a surface. But when we say a preface, it means that when we say a preface, that word comes. So peri like this is a preface, pericardium. Do you understand? Then when we come to I think IT, we have peripheral. So peri means outer. Do you understand? However, we are talking about what? Surface here. So the surface that we are talking about here is cardium. So the surface cardium, which is gotten from the Greek word cardia, mean the heart. However, it is used to mean heart tissues or organ. So anywhere you meet the surface cardium, it means what? Heart tissue. Do you understand? So pericardium. So if peri means what? Out, it means that we are talking about the outer layer of the heart tissue or of the heart. Myocardium. So myo means what? Muscle. All right. So myo is a prefix in anatomy, which means what? Muscle. So the myocardium is the muscular layer of the heart, and then the endocardium is the innermost layer of the heart. So those are the external structures of the heart that we have. So what we are now going to do is that we are now going to take each of these layers one after the other and speak of them. Let's look at what they are made of and then what function they perform. Is that okay? All right, so let's go. So we will start off with the pericardium. We'll start off with the pericardium. Since that is the outermost layer of the heart, we'll start off with it, the pericardium. So we are saying that the pericardium is the membrane that surrounds and protects the heart. So it is the outermost layer of the heart that surrounds it and protects it. So its function is that it confines the heart to its position, the position that we just spoke about. All right, so it confines the heart to its position in the mediastinum and allows for sufficient movement for vigorous movement and contractions. You know, the heart is made to contract. Sorry, I think there is somebody in the meeting who hasn't muted herself. Oh, it's my boss. Boss man, you're welcome. Boss Clever, you're welcome. I welcome you, my boss. All right, so let's continue. So the pericardium is the membrane that surrounds and protects the heart. So what it does is that it confines the heart to its position in the mediastinum and allows for sufficient movement for vigorous movements and contractions. You know, the heart contracts, so as it is contracting, it needs some space. Is that okay? However, the pericardium is made up of two main parts. We have the superficial fibrous pericardium and the inner serous pericardium. Don't forget that the pericardium is the outermost layer of the heart. So the heart is made up of three layers: the pericardium, the myocardium, which is the muscular layer, and then the endocardium, which is the innermost layer. However, the pericardium is made up of two main parts, which is the superficial fibrous pericardium and the inner serous pericardium. So now let's go and look at the superficial fibrous pericardium, then the innermost serous pericardium. Okay, all right, let's go. Okay, so fibrous pericardium. So the fibrous pericardium, we are saying that is the outer part of the pericardium, and it is made of a tough, inelastic, dense, irregular connective tissues. All these, I know you've studied it under tissue, so I wouldn't go so much into it. Then it resembles a bag that rests on and is attached to the diaphragm. By this time, by now, I know that you should be familiar, or you should be well acclimatized to the fact that the outermost part of the heart rests on the diaphragm. Okay, that is inferiorly, it rests on the diaphragm, what we just spoke about. All right, so its function is that the function of the fibrous pericardium is that it prevents the overstretching of the heart, and also it provides protection and anchors the heart in the mediastinum. So basically that is its function: prevent the overstretching of the heart. So in a case whereby the heart has to beat vigorously or more vigorously, let's say in a flight mode, okay, in a fight or flight mode where the heart has to beat vigorously, it is going to protect the heart and anchor it to the mediastinum that it doesn't shake. Do you understand? That one that people's hearts will be beating and they'll be like, my heart wants to fall into my stomach. My sister, please, the heart will never fall into the stomach. It will be held in its place by the fibrous pericardium. So please and please, what do you want to say? Please and please reassure your patients that their heart will never fall into their stomach. They are two different organs. All right, let's continue. Okay, so just as you can see, we have our pericardium. We have our pericardium that has been cut away. Do you understand? We have our pericardium that has been cut away, and that is what we're talking as what our fibrous pericardium. The top here, this layer right here that has been cut off, that is what we're referring to as our fibrous what pericardium. So it is a layer that is covering the heart. Is that okay? And it is anchoring it to the diaphragm. So we still have our diaphragm here, and then the pericardium is anchoring the entire heart to the diaphragm so that it will not be shaken from its position, which is the mediastinum. You understand? All right, let's move to the next slide. All right, so now we are on the serous pericardium. Hello, and then if you are new here, we are just talking about the heart. We've already started looking at the position of the heart, and then we are now looking at the outer or the external structures of the heart. So we are saying that with the external structures of the heart, we have the pericardium, we have the myocardium, and we have the endocardium. So we started looking at the pericardium, and with the pericardium, we look at what's the outermost layer of it, and now we are on the serous pericardium. So we look at the fibrous pericardium, and we are now on the serous pericardium. So now, like every other serous membrane that you know, every serous membrane has a parietal layer and a visceral layer. Is that okay? So the serous pericardium is a thin double layer of tissue that surrounds the heart. Don't forget that it is still part of the pericardium, so it is still surrounding the heart. Now it has an outer layer and then an inner layer. The outer layer is what we call the parietal layer. So we have the parietal layer right here, and we have the visceral layer. So the outer parietal layer is fused to the fibrous pericardium. Don't forget that the fibrous pericardium is outside. So if something is out again, it should be connected to the one that is outside. You understand? Then we also have the inner visceral layer, which is also known as the epicardium. My students, please pay heed to this. So the inner visceral layer of the pericardium is called the epicardium. It is called what? Repeat after me. The epicardium. All right. So the inner visceral layer of the serous pericardium is called the epicardium, and it adheres tightly to the surface of the heart. Don't worry, we'll be going shortly to an image where I would explain all this to you visually. Is that okay? So the inner visceral layer, which is also known as the epicardium, adheres tightly to the surface of the heart. Now, between the parietal layer and the visceral layer is a thin space called the pericardial cavity. It is called what? The pericardial cavity. Don't forget, we are still talking about the pericardium. All right, so I will take it again. The serous pericardium is made up of what? Two layers. We have the outer parietal layer and then the inner visceral layer. So the inner visceral layer is also called the epicardium. Now the inner visceral layer adheres tightly to the surface of the heart itself. Do you understand how? Whereas the parietal layer is what is fused to the fibrous pericardium. And then also between the parietal layer and the visceral layer is a thin space. There is a thin space between the parietal and the visceral layer called the pericardium, a pericardial what? Cavity. All right. So once it is a space, it is going to be called a cavity. Now this cavity is filled with a film of thin serous lubricating fluid called the pericardial fluid. So you can see everything we're talking about here is pericardial. So it is called what? The pericardial fluid. Now this fluid helps to reduce friction between the serous pericardium as the heart moves or as the heart pumps. Are we there? So let's move to the next slide, and then you see the image. We'll come back here for more explanations together with the picture. Then I'm sure that by the end of it you'll get more to add to what you just read from here. All right, let's go. Very good. So here we have our hearts, our beautiful hearts right here. We have our pericardium. So we said that the pericardium is the outermost layer of the heart. So you see that the pericardium has been cut surgically, yes, surgically and beautifully. Then we now have a picture of our pericardium right here, which has been zoomed in. Are we there? So the picture has been zoomed in. So now that the picture has been zoomed in, we are saying from here that our pericardium is made up of fibrous pericardium and what is the serous pericardium. So now this arrow is directing us to what the fibrous pericardium is. So the fibrous pericardium is the outermost layer of the heart, which is this whole place, this outermost layer that we are seeing. Do you understand? So I believe you can see the apex of the heart here too. So you remember the other picture that we saw, no? This apex of the heart is attached to the diaphragm. So we are saying that the outer fibrous pericardium is attached to the diaphragm. Do you get it? So that is what we can see, the fibrous pericardium, which is the outermost layer. Now, aside the outermost layer, which is the fibrous pericardium, we have a serous pericardium. The serous pericardium is made up of the parietal pericardium and what's the visceral pericardium. And we said that the visceral pericardium, which is the innermost, we said that the visceral pericardium, which is the innermost one, is also called the epicardium because it attaches directly to the heart itself. Do you get it? It attaches directly to the heart itself. Now, in between the parietal pericardium and the visceral pericardium, there is a space, and that space is called what? The parietal or the pericardial cavity. Do you understand? So in the pericardial cavity, we can find what? A pericardial fluid. And the function of this pericardial fluid is to help lubricate what? Lubricate the heart or reduce friction in between what? The serous membranes, which is the parietal layer, and then the visceral layer as the heart moves or as the heart pumps. So let's move to the next slide. Another picture that would help you understand more. All right, so right here, this is what we're talking about. So this is a layer of the heart, the complete heart, layer of the heart. So we have our fibrous layer out here. Do you understand? So we have our fibrous layer, then we have our what? Our parietal layer. Do you understand? So both fibrous layer, this fibrous layer here, parietal layer, and the visceral fibrous layer, parietal pericardium, and then the visceral pericardium, they are all making what? The outermost part, which is what? The pericardium. Do you understand? So you have the fibrous layer, and you realize that the parietal pericardium is attached to the fibrous layer. Do you understand? It's attached to the fibrous layer. Then the visceral pericardium is attached to the myocardium. It's attached to the heart itself, which is the myocardium. Are we following? And then there is a space between the visceral pericardium and the parietal pericardium. So this whole space that we call, this whole space that we have here is what we are calling the pericardial cavity. So in that cavity is where we have our serous fluid that helps to lubricate the heart as what is happening. That helps to lubricate the heart as the heart is pumping or as the heart moves. You understand? That's what we're talking about here. Okay. So now I believe you've all understood the fibrous layer, or yes, the fibrous layer of the heart. We understand the pericardial, the parietal pericardium and the visceral pericardium, and we are saying that what? All these things constitute what? The epicardium. So if we actually understand that, then the next thing that we're going to be looking at is the myocardium. All right, you see how big the myocardium is from this level to this level. That is the myocardium. Then we have the endocardium, which is just a thin layer of what? Endothelial lining that lines the inner parts of the heart. Let's not run before ourselves. So let's now look at the myocardium. Great. So the myocardium is the cardiac muscle tissue of the heart, and then its function is to pump blood, or yes, its function is for what? Basically what? Pumping. So the myocardium is the cardiac muscle tissue of the heart that is responsible for the pumping action of the heart. So anytime that you touch your heart, should I say your heart? No, anytime that you touch your sternum, or yes, or your chest, and you feel your heart beating, my dear, that is the function of your myocardium doing its work. So the myocardium is the cardiac muscle tissue of the heart that is responsible for the pumping action of the heart. Then the endocardium, which I said is the innermost layer of it, is the endothelium. So the endothelium is a thin layer of the endocardium. Okay, so the endocardium is a thin layer of endothelium overlying a thin layer of connective tissue, which provides a smooth lining for the chambers of the heart, as well as covers the valves of the heart. So that is the function of the endocardium. So it is, just as I said earlier, it is just a thin layer of what? Endothelium. All right, that's what that lines what the chambers of the heart, as well as what it covers the valves of the heart. So we are now done with the external structures of the heart, and the next thing that we're going to be looking at is the internal structures of the heart chambers. The internal structures of the heart chambers. That is the next thing that we are going to be looking at, the internal structures of the heart chambers. So the heart has 4 chambers, just as you might have known. We have the 2 superior receiving chambers, which is called the atria. All right, the 2 superior receiving chambers. Superior means that it is not above, or it is at the top. Okay, and then inferior means that what? It is below. So we have the 2 superior receiving chambers, as well as the 2 inferior pumping chambers. So all the chambers at the top are actually receiving chambers. They are just to be receiving. That is their function and nothing else. Then the inferior chambers, they are just for pumping. Their function is to pump. So the superior chambers receiving chambers that we have is what we call the atria, singularly atrium. All right, and then the 2 inferior pumping chambers that we have is what we call the ventricles. All right, so note, the first thing that you should note is that on the anterior surface of each atrium, anterior, which means what? The front. Okay, so on the front surface of each atrium is a wrinkled pouch-like structure, called the auricle. Now it is named so because of its resemblance to a dog's ear. All right, oftentimes I hear people calling the atrium auricle. However, the auricle is just a wrinkled pouch-like structure on the anterior surface of the atrium. Are we following? So it is, the auricle is not the atrium itself, or it is not the atria itself. You get a point. And then 2, on the surface of the heart are a series of grooves. When we say grooves, we are talking about like holes, you know, or should I say gutters? Yes, so a series of grooves like holes or like gutters like that, called sulci. So they are called sulci, singularly sulcus. So on the surface of the heart are a series of grooves called sulci, singularly sulcus, that contain coronary blood vessels and a significant amount of fat to insulate the heart. The coronary blood vessels, anything you hear coronary, it means that the thing supplies what? Blood to the heart itself. So it has coronary blood vessels, so blood vessels that supplies blood to the heart walls itself. All right, as well as a significant amount of fat that will help insulate the heart. So the fats that are around your heart are actually to help what? Insulate your heart from what? Heat. You are following? So 1, the auricles that we see, or yes, the wrinkled pouch-like structures that we see are called auricles, and they are not actually the atriums or the atria itself. Is that okay? All right, so that being said, let's move on to the next slide. Okay, so very good. So this, the sulci of the heart, I said that the sulci comes in the form of what? Ridges or like gutters. Do you understand? On the heart. So this is a sulci. Oh no, sorry, this is a sulcus. Your singularly is sulcus, and then plurally it is sulci. So this is the sulcus, and then in the sulcus you can see the fat deposition. You see the fats they are the yellow stars deposited. Then we can see the auricle. So this is the auricle. You see how it is looking like the ear of a dog, you know? That is why we call it auricle. So this is another auricle, and then the auricles are actually on the anterior aspect of the atria or of the atrium. Then we have our coronary blood vessels, our coronary artery, which is this red one. That is what supplies oxygenated blood to the heart wall. And we have the coronary vein, which supplies what, or which takes deoxygenated blood from what, the heart wall into the right atrium. Is that okay? So that is what, from what we just studied. This is its image. So let's now move on to our next slide. Great. So we will now start with the atria, or the receiving chambers. So the atria are the two receiving chambers of the heart that receives blood from all parts of the body. So the function of the atrium or the atria is to receive blood from all parts of the body. That is its function. Now we have the right atrium and the left atrium, with each of them having its own connections and sources that it receives blood from, and function, and the functions that they perform. Are we there? So each of these chambers has their own functions that they perform, right? So that being said, but then they are receiving chambers, don't forget. That being said, let's start with the right atrium. Let's start with the right atrium, and there we go. So the right atrium forms the right border of the heart. It forms what, the right border of the heart, and it receives deoxygenated blood. Deoxygenated blood means what? Blood that does not contain oxygen. So it receives deoxygenated blood from all parts of the body through 3 veins, and these veins are the superior vena cava, the inferior vena cava, and the coronary sinus. All right, so the superior vena cava collects deoxygenated blood from the upper part of the heart. So all the parts that are above the heart, so your chest and then above to your head, the blood vessel that collects deoxygenated blood into the right atrium is what, the superior vena cava. Don't forget, still superior, above. You understand? Then we go inferior. Then we have the inferior vena cava. So the inferior vena cava collects blood from all those parts that are below your heart. You understand? So from your chest wall downwards of your chest wall, all those areas to your leg. The blood vessel that collects the deoxygenated blood into the right atrium is what, the inferior vena cava. And we have the coronary sinus. So the coronary sinus is actually an opening. Are we following? The coronary sinus is actually an opening in the right atrium, where all deoxygenated blood from the heart walls itself passes through and comes into the right atrium for it to continue what, it's moving. Is that okay? It's movement. So now blood then passes from the right atrium. So when all this blood from all these areas passes through these 3 veins into the right atrium, the blood then passes from the right atrium to the left ventricle through a valve. Now that valve is called the tricuspid valve. It is called what? The tricuspid valve. So it has what here? Tri, tri, which means 3. So it is called a tricuspid valve because it is made of 3 cusps. All right, it is made of what? 3 cusps. Now it is also called the right atrioventricular valve. Atrioventricular in the sense that it is a connection between the atrium and the ventricle. Are we following? And then it is found on the right side. So that is why the tricuspid valve is called what? The right atrioventricular valve. So blood passes through this valve into what? The left and into the right what? Ventricle. Is that okay? All right. Now the anterior wall of the right atrium is rough. The anterior wall of the right atrium is rough due to the presence. You see how we are using these anterior posterior things, so you really have to be conversant with them. All right, for you to be able to do well in anatomy, you should be able to be conversant with your anatomical positions. All right, you should be able to be conversant with prefaces and surfaces, like that myocardium we saw there, that the surface cardium means heart, pulmonary means what? Lungs. You should be conversant with those things. You understand? So the anterior wall of the right atrium is rough due to the presence of some muscular ridges called pectinate muscles. All right, that is what causes the anterior wall of the right atrium to be rough. We will see an image of that right now for you to understand. Now, between the right atrium and the left atrium is a thin partition of tissue called the interatrial septum. Interatrial what? Septum. Repeat after me. Interatrial what? Septum. So between the right atrium and the left atrium is a thin partition called what? The interatrial septum. Are we there? Then on the interatrial septum is an oval depression. On the interatrial septum is an, sorry guys, all right, on the interatrial septum is an oval depression called fossa ovalis. Now this fossa ovalis is a remnant of the what? Of the foramen ovale. If you joined our class in on last week, I think that is last week Wednesday, if you joined the class on fetal circulation, you should be conversant with foramen ovale. Do you understand? You should be conversant with what? Foramen ovale. All right, so the foramen ovale normally closes after what? After birth. All right, okay. So when it closes, it form what? The fossa ovalis, which is what? The septum, which is the an oval depression what? On the interatrial septum. So now let's see an image that would help us to understand all those things. So this is the right atrium. The right atrium has been cut open. All right, it has been cut open. We can see the superior vena cava, which is the SCV, superior vena cava, which collects blood from the upper part of the body, which is above the heart. We have the inferior vena cava down here, these blue ones, all right, which collects deoxygenated blood from all the parts that are below the heart. Then we have the fossa ovale, which is the depression right here. Then we have what? The opening of, sorry, I can't see it, but I believe you can see it, which is the opening of the coronary sinus, which collects blood for a deoxygenated blood from the heart walls themselves. You understand? And we can also see our pectinate muscles right here. So you see, this is the anterior surface. This is the anterior surface of what? Of the right atrium. Are we following? That is the anterior surface of the right atrium. Sorry guys, just a minute. Okay, so sorry for that shortcut. All right, so now let's continue with the left atrium. So the left atrium forms most of the base of the heart. You remember the base that we spoke about? So the left atrium forms most of the base of the heart, and it receives oxygenated blood. Don't forget, we are saying that what? The superior chambers are just receivers. They just receive, all right? So we saw that the right atrium receives deoxygenated blood. However, the left atrium receives oxygenated blood from the lungs, because that is where oxygenation takes place. So it receives oxygenated blood from the lungs through 4 pulmonary veins. All right, through 4 pulmonary veins. Don't forget, all veins carry deoxygenated blood except the pulmonary vein. So we can see here that the pulmonary vein is carrying oxygenated blood from the lungs, all right, towards to the left atrium. Is that okay? So all veins carry deoxygenated blood except pulmonary veins. So if you meet a question that all veins carry deoxygenated blood except dash, then they put the carotid vein, pulmonary vein, jugular vein, and the rest. You should know the answer to pick. Okay, all right, that is why you're here. Okay, then we also have Yeah, so it receives oxygenated blood from the lungs through 4 pulmonary veins, 2 from the right lung and 2 from the left lung. Now, blood passes from the left atrium to the left ventricle through the bicuspid or the mitral valve. So the bicuspid, just as we saw tricuspid in the left atrium, is named because it's made up of what? 2 cusps. All right. So the bicuspid valve is also called the left atrioventricular valve. It is located on the left side and it is between what? The atrium and the ventricle, just as we saw at the other side. So let's move on. All right. So this is what we can see, the pulmonary vein. So we have our right lung here, our left lung here, we have our left atrium here, and we have these 2 pulmonary veins. All right, we are saying that the pulmonary veins are carrying oxygenated blood from the lungs. So you see the pulmonary veins are actually in the lungs and they are connected to what? To the left atrium. This pulmonary vein on the right lung too, in the right lung too, is also connected what? To the left atrium. They are all bringing in what? Oxygenated blood. Is that okay? All right, let's move on. All right, then we now move to the inferior pumping chambers, which is the ventricles. So the ventricles are the chambers of the heart responsible for the pumping of blood, that is both deoxygenated blood and unoxygenated blood. These 2 inferior chambers are designed in a way that one pumps deoxygenated blood into the lung for oxygenation and the other pumps what? Oxygenated blood from the lung to all parts of the body. Are we there? So let's begin with the right ventricle, which is the one that pumps what? Deoxygenated blood. There we go. So the right ventricle is the right inferior heart chamber that receives deoxygenated blood from the right atrium. Now, this deoxygenated blood is then pumped from the right ventricle through the pulmonary or the semilunar valve into a large artery called the pulmonary trunk. Now, this pulmonary trunk divides into pulmonary arteries and enters into the lung where the blood is oxygenated. Once again, we met something here. Pulmonary or all arteries carry oxygenated blood except pulmonary artery. So the pulmonary arteries that we have here are actually carrying deoxygenated blood to the lung for it to be oxygenated. Are we there? Now, internally, the right ventricle is separated from the left ventricle by a partition of tissues called the interventricular septum. In the atriums, it was what? Interatrial septum. However, in the ventricles, it is what? Interventricular septum. That is what? Between what? The septums. Sorry, between what? The ventricles. Is that okay? All right. Okay. So let's move from there. Okay. All right. So this is an image that would help us to see what? The interventricular septum. So this is our right ventricle, this is our left ventricle, and this is the layer of tissue that is separating the 2 of them, which we call our interventricular septum. Are we there? Our interventricular septum. All right, there we go. Okay, so we also have an image here giving us, a clear view of how our pulmonary veins look like, how our pulmonary veins and then how our pulmonary arteries looks like. So we have our pulmonary veins right here. So here they are. This is the first one. That is to the right, to the left lung. So our pulmonary vein here, first one, second one, moving into the lung. So it is the pulmonary vein is sending what? Oxygenated blood into the lung. Sorry, it's bringing oxygenated blood from the lung to the heart, which is into what? The left what? Into the left atrium. All right, and then what we have there? Pulmonary artery, which is what? Taking deoxygenated blood from the right side of the heart, most or particularly the right ventricle to the lung for what? For oxygenation. All right, let's move on. Now let's talk about the left ventricle. So the left ventricle is the thickest or the most muscular chamber of the heart and forms the apex of the heart the apex that we saw in the beginning slide. Yeah, so the left ventricle is what forms the apex of the heart. So blood from the left ventricle is pumped through the aortic valve or the aortic semilunar valve into the ascending aorta. Into the what? Ascending aorta. Now, some of the blood from the aorta flows into the coronary arteries. We said that what anything coronary is what talking about what the heart walls. So it flows into the coronary arteries and carry oxygenated blood to the heart wall. Very good. Then now, most parts of the pumped oxygenated blood from the left ventricle passes into the arc of the aorta and then descending aorta. So the arc of the aorta is what is supplying or what is moving upwards to supply what the uppermost part of the heart with what oxygenated blood, and then it still has a branch that descends. So the blood, so the branch that descends is also divided into two, the thoracic and the abdominal. So the thoracic is the aortic branch that branches into the thorax, right, or into the chest walls. Is that okay? Then the abdominal aorta is the branch of the aorta that branches into the abdomen, down into the abdomen. You understand? So in all this, it is carrying what oxygenated blood to what, to all the parts of the body. So the function of the left ventricle is simply pumping oxygenated blood through the great arterial vessels to all parts of the body. As simple as A, B, C. Let's go. Now let's talk about the flow of blood through the heart. Let's now talk about the flow of blood through the heart. We've now understood the basics. We've now understood the external structures. We've now understood the internal structures. We are now on to how the flow of blood actually happens through the heart. So the heart pumps blood into two circuits, the systemic circulation and the pulmonary circulation. So we have two forms of circulation, the systemic circulation and the pulmonary circulation. By this time, you should know that anything pulmonary is talking about the heart, right? Anything pulmonary is talking about the heart. So we have the systemic circulation and the pulmonary circulation. Now, the two circuits are arranged in series. The output of one becomes the input of another. So it's just like when one gives something out, the other receives it. You understand? So the left side of the heart is the pump for the systemic circulation, whilst the right side of the heart is the pump for the pulmonary circulation. Don't mind you, when we are talking about pump here, you should know that it is about the ventricles, because they are the pumping structures of the heart. All right, okay. So now let's move on to the systemic circulation. With the systemic circulation, we are saying that in the systemic circulation, the left atrium receives oxygenated blood from the pulmonary veins. All right. Now, on contraction of the left atrium, blood is shunted through the bicuspid valve into the left ventricle. Don't forget, the bicuspid valve is the valve that separates what the left atrium from the left ventricle. So blood is shunted through the bicuspid valve or bicuspid or the mitral valve into the left ventricle. Now, the left ventricle then contracts and pumps the oxygenated blood through the aortic semilunar valve into the aorta. Some of the blood from the aorta enters the coronary arteries to supply oxygenated blood to the heart walls. I believe we spoke about all these things already, you know. Then from the aorta, the oxygenated blood then moves through the ascending and the descending aorta. And then we said that the descending aorta branches into thoracic and then what, abdominal aorta, which in turn supplies what, all the tissues, which then supplies all the tissues of the body except the air sacs, which is the alveoli of the lung. So the alveoli of the lung are also supplied by pulmonary circulation, just as the muscular walls or the tissues of the heart itself is supplied by coronary circulation. The tissues of the lung, most especially the air sacs or the alveoli, are also supplied by pulmonary circulation. Are we following? Okay. All right, let's move on now. So I believe we understand this, the systemic circulation. So the left atrium receiving oxygenated blood from the pulmonary veins. Then on contraction of the left atrium shunts blood through the mitral or the bicuspid valve into the left ventricle. Then on contraction of the left ventricle, it also pumps blood through the aortic semilunar valve into the aorta. Now some of the blood from the aorta enters the coronary arteries, which helps to supply the heart wall with nutrients and then oxygen. All right, then from the aorta, the oxygenated blood now moves through the descending and then the ascending aorta into all tissues of the body. Great. Now you should know that in the tissues, arteries divide into arterioles. So smaller vessels of the arteries is what we call the arterioles, and then these arterioles also empties into a bed of systemic capillaries. All right, so capillaries are bed of connected tiny blood vessels where exchange of nutrients and gases takes place. So in the tissues, the arteries divide into arterioles. Now these arterioles then enters into a bed of systemic capillaries where exchange of nutrients and gases takes place. Now the oxygenated blood offloads its oxygen and then picks up carbon dioxide. Yeah, hello, I think somebody is not muted. Delight. Hello Delight, do you have a question for us? Hello Delight. Okay, I think it was a mistake, so let's continue. Okay, all right, so we are saying that the oxygenated blood that the systemic circulation carries is being offloaded. So it offloads, so the oxygenated blood offloads its oxygen. So the oxygen that it is carrying from the lungs, it offloads the oxygen and then picks up carbon dioxide. You understand? And then picks up carbon dioxide, and this happens in all these things is happening in the capillaries. Are we following? Because we are saying that in the tissues, arteries divide into arterioles, which then enters into a bed of systemic capillaries where exchange of nutrients and gases takes place. So still in the capillaries, the oxygenated blood offloads its oxygen. The oxygen that it is carrying, it offloads the oxygen, and after it offloads the oxygen, it picks up carbon dioxide. So carbon dioxide is the next thing that it picks up because it is exchanging. So when you leave one, you have to carry one. You understand? So it has offloaded the oxygen and it picked up carbon dioxide. Do you understand? So the blood, which is now deoxygenated because the oxygen has been deported. Yes, the oxygen has been offloaded. So now that it has offloaded oxygen, it is now carrying carbon dioxide. So the blood, which is now deoxygenated, flows into a systemic venule. There we go. Don't worry, you understand. Into a systemic venule. Now these venules carry the deoxygenated blood now from the tissues and merges to form larger systemic veins. All right, which then carries the deoxygenated blood through the vena cava, which is the superior and inferior vena cava, as well as the coronary sinus into the right atrium. So what we are saying shortly is that the smaller form of arteries are arterioles, and the smaller form of veins are venules. Do you understand? So the smaller form of arteries are arterioles, and the smaller form of veins are venules. All right, so sorry guys about that. So sorry about that, guys. So let's continue. All right, so I was saying that the smaller form of arteries are arterioles, and the smaller form of veins are venules. Do you understand? Now for the capillaries, we have systemic capillaries and we have pulmonary capillaries. Is that okay? So now, having understood that, let's go back to what we said earlier. Note, in the tissues, arteries divide into arterioles, all right, which then enters into a bed of systemic capillaries where exchange of nutrients and gases takes place. So the oxygenated blood offloads its oxygen and then picks up carbon dioxide, and all this thing is happening in the capillaries. All right, now the blood, which is now deoxygenated, flows into a systemic venule. Don't forget, venules are the smaller form of veins. Now these venules carry deoxygenated blood from the tissues and merges to form larger systemic veins. So these venules merges to form larger systemic veins, which then carries the deoxygenated blood through the vena cava, which is the superior vena cava and the inferior vena cava, as well as the coronary sinus. We said that the coronary sinus collects what deoxygenated blood from the heart walls itself into the right atrium. Are we there? So that is what happens. So all this blood is now collected into the right atrium. Great. So that is about what the systemic circulation. So systemic circulation, first of all, the left ventricle receiving oxygenated blood from the coronary from the pulmonary veins. Then in the left atrium, blood moves from the left atrium through the bicuspid or the mitral valve into the left ventricle. The left ventricle now pumps this oxygenated blood through the semilunar valve into the aorta. The aorta now branches into the ascending and the descending aorta. The ascending aorta sends the oxygenated blood to parts of the body that is above the heart, that is to the head and the like. Whereas the descending aorta now branches into the thoracic and the abdominal aorta. So the thoracic aorta supplies oxygenated blood to all the areas in the thorax, that is in the chest wall, whereas the abdominal aorta supplies oxygen or oxygenated blood to all the areas in the abdomen. Are we there? All right, so that is basically about the systemic circulation. Great. So now let's move on to pulmonary circulation. Don't worry guys, we will soon end. We are almost at the end of our slide. So the right side of the heart is the pump for the pulmonary circulation. The right ventricle receives all the deoxygenated blood. Sorry guys, it is rather supposed to be the right atrium. All right, so this is not supposed to be ventricle. So the right atrium receives all the deoxygenated blood returning from the systemic circulation, and ejects it into the right ventricle through the tricuspid valve. And we said that the tricuspid valve is also known as the right atrioventricular valve. All right, it's also known as the right atrioventricular valve because it is located on the right side. All right, now the right ventricle then pumps this deoxygenated blood through the pulmonary valve into the pulmonary trunk. So the right ventricle then pumps this deoxygenated blood through the pulmonary valve into the pulmonary trunk, which branches into pulmonary arteries, which leads to the right and the left lungs. Don't forget, in pulmonary circulation we will just be hearing pulmonary because we are now moving to the lungs for oxygenation, you know. So the right ventricle then pumps this deoxygenated blood through the pulmonary valve into the pulmonary trunk, which branches into the pulmonary arteries, then moves on to the right and the left lungs. Don't worry, when we get to the image you best understand. Okay, now in the pulmonary capillaries, the deoxygenated blood offloads its carbon dioxide. So the pulmonary capillaries we are now talking about in the lungs. So the pulmonary capillaries are located in the lungs. So in the pulmonary capillaries in the lungs, the deoxygenated blood offloads its carbon dioxide, which is exhaled, you know. So the carbon dioxide that we exhale was actually what is deposited after pulmonary circulation. All right, sorry, after systemic circulation. Then it now picks up the oxygen that we are inhaling. You get it? That is what happens. Now the freshly oxygenated blood flows into the pulmonary veins and returns to the left atrium, where systemic circulation begins again. So just as we said, these two circulation move hand in hand. Once the other one is done, the other one has started. So once systemic circulation is done, pulmonary circulation begins in that order. That is what happens. You get it? So let's move on to the next slide. Very good. So here we can see our heart beautifully, very beautifully labeled for us. We have the artery, the aorta, the pulmonary artery, the pulmonary veins, left atrium, mitral valve, left ventricle, Purkinje fiber. Don't worry, we haven't spoken about Purkinje fiber because we didn't talk about the conduction system of the heart. Then we look at the septums, the aorta, the vena cava, and then all these stuffs. All right, so now let's use this picture to explain the systemic circulation and what the pulmonary circulation. Is that okay? Now we are saying that for the systemic circulation, blood from the lung, all right, so you see from left lung, all right, from right lung. So this is what the pulmonary veins, which is labeled here. So we have our pulmonary veins, all right. So oxygenated blood from, mind you, oxygenated blood is always denoted with red. So when you see a red vessel, is oxygenated blood. When you see a blue vessel, it means what? A deoxygenated blood. All right, so oxygenated blood from the left lung enters the left atrium towards the left pulmonary veins. Likewise, oxygenated blood from the right lung enters the left atrium to the right pulmonary veins. Are we there? So oxygenated blood from the lungs enters the left atrium to the pulmonary veins. Now from the left atrium, the oxygenated blood passes through the mitral valve or the bicuspid valve into the left ventricle. Are we there? Now from the left ventricle will now contract and pumps the blood through the aortic or the aortic semilunar valve, which is this valve here, into the aorta. Are we there? Now we can see that sorry about that, guys. Okay, right. So I was saying that on contraction of the left ventricle, this oxygenated blood passes through the passes through the aortic semilunar valve into the aorta. So you can see the aorta here. All right, now the aorta, now this is moving to the upper body. You understand? Now the aorta now branches. All right, the aorta now branches and comes down here. All right, so we have the descending aorta right here. So while these arteries are supplying the upper body with oxygenated blood, the descending aorta, which now branches into the thoracic aorta, and then the abdominal aorta, supplies the thoracic cavity, or the organs in the thoracic cavity, as well as the organs in the abdominal cavity. Do you understand? So simply put, that is about systemic circulation. Do you understand? So blood now moves through all those arteries into arterioles, into the systemic capillaries. Then in the systemic capillaries, that is where the oxygenated blood now offloads its oxygen. It offloads its oxygen and then carries carbon dioxide. So the oxygen is now offloaded and it carries carbon dioxide. Do you understand? So now that these arteries, now that these capillaries, or now that this oxygenated blood has offloaded its oxygen and carried carbon dioxide, it has now become a deoxygenated blood, a blood that does not contain oxygen again. Yeah, that's why we say deoxygenated. So now this deoxygenated blood now passes through venules. All right, don't forget, veins carry deoxygenated blood. So the smallest form of veins are venules. So it passes through the deoxygenated blood passes through venules. Now these venules now comes to join to form the veins. Is that okay? These veins now move all the way up and it comes to join the vena cava. All right, so we have the superior vena cava here, which collects deoxygenated blood from the upper body parts, and we have the inferior vena cava here, which collects deoxygenated blood from the lower part of the body. Do you understand? And we also have the coronary sinus. Anyway, the coronary sinus has not been named here. So the coronary sinus, which is also in the right atrium, also collecting what deoxygenated blood from the heart wall into the right atrium. So you see, all this deoxygenated blood will now come and enter into the right atrium right here. I'm even using my hands to show. Sorry guys. So into the right atrium. Then from the right atrium, blood will now be shunted, or on contraction of the right atrium, blood will now move through the tricuspid valve. All right, through the tricuspid valve, also known as the right atrioventricular valve, through the tricuspid valve into the right ventricle. Are we there? Now the right ventricle will also now contract and pump the blood through the pulmonary artery. All right, through the pulmonary artery right here. So you can see a pulmonary artery to the left lung, then through this one to the right lung. You get it? So to the left lung, to the right lung for oxygenation. As simple as that. You see, so that is how both systemic circulation and pulmonary circulation happens. I think, or I believe that you've learned something from today's lectures. Okay, very good. We have another slide here. So we are saying that the right atrium, so you can see this superior vena cava right here, inferior vena cava right here. We have the pulmonary trunk right here. You understand? So we are saying that the right atrium receives deoxygenated blood from the body through the superior vena cava, inferior vena cava, and coronary sinus. That is the right atrium. So it is receiving blood from all these three things: the superior vena cava, inferior vena cava, and the coronary sinus. Is that okay? Now after it receives the blood, it is pumping the blood. So you can see the blue line. So the blue line indicates, the blue arrow indicates deoxygenated blood. So it is now pushing the blood through the right side. We have tricuspid valve. Your right is always your strongest, so 3 men has to be there. So we have 3 people that are cusping, or that are how do we even say it, that are protecting the walls that are protecting your right ventricle. You understand? So that we have the tricuspid valve here, that the deoxygenated blood will move through the tricuspid valve into the right ventricle. Are we there? So now the right ventricle receives deoxygenated blood from the right atrium through the right atrioventricular orifice. The orifice is like an opening. You understand? And sends it to the lungs through the pulmonary trunk. So it now pumps it through the pulmonary trunk here, then into the lungs. Do you get it? Into the lungs, into the lungs. Do you understand? Now let's come to the right side. Sorry, the left side. From the lungs, we have our pulmonary veins. All right. So the left atrium receives oxygenated blood from. Oh, sorry guys, what is happening? Was I writing something here? Oh, sorry, I picked something. I was doing something. All right, let's continue. So the left atrium receives oxygenated blood from the lungs. Okay, the left atrium receives oxygenated blood from the lungs through the pulmonary veins. Are we there? Through the pulmonary veins, and then receives oxygenated blood through the pulmonary veins. So as it receives the oxygenated blood through the pulmonary veins, the oxygenated blood enters the left atrium, and then the left atrium on contraction pushes it through the bicuspid valve, or the mitral valve, into the left ventricle. Let's see what the left ventricle does. The left ventricle also receives the oxygenated blood from the left atrium through the left atrioventricular orifice, which is the opening, and sends it to the body through the aorta. So simple put, that is our lectures for today. Thank you, and as always, the Clever Brothers is grateful for your participation.